And good afternoon. It is now March 14, 2024. I'm Dr. Deuk here at Deuk Spine Institute with my team, getting ready to treat a patient with 2 bad discs in his back. Now, he's had back pain for 12 years. And he has 2 discs that are injured with annular tears. And that's where his pain's coming from. That's based on my experience and professional opinion. We can confirm that today during the surgery when we do a discogram. Are you comfortable? All right, so for now the patient is resting. We're going to first start by placing a needle called a spinal needle within the spine. Shot. And the first thing we do in surgery is we always bring the patient back to the operating room, and then we position them on the table. It's called positioning. Then we prep and drape, which means we clean their body part we're operating on with antiseptic, and we put on sterile drapes. So we can do a surgery that's sterile. We're going to go 5-1 first. Looks good there, Jordan. And then we access. It's called access. We're accessing or getting to the part of the body we're actually treating. In this case, the lumbar spine, specifically the L4-5 and L5-S1 discs. Shot. Now, our patient here has had back pain for 12 years, and he found us on YouTube, thanks to Henry and Henry's great work. Shot. And he did a Zoom meeting with me. Shot. And then he showed up, and here he is having his back fixed. AP. He has discogenic pain. That's the cause of his back pain. So folks, for many years and even today, many doctors will tell you that they don't know why you have back pain. They call it non-specific back pain, and doctors are not able to fix it. However, Deuk Spine is the first in the world to be able to consistently fix back pain, pretty much on every patient with degenerative problems, like this patient, for example. And the reason we're able to do that is because we have technology that allows us to do it. That technology is really 3 procedures that we developed here, I developed at Deuk Spine Institute. The first one is called the Deuk laser disc repair. And that is a surgery that we're doing right now, and it's designed to eliminate back pain, neck pain, from a disc injury, a painful disc injury. The second procedure is the Deuk plasma rhizotomy, which is designed to eliminate pain from a joint in the spine other than the disc, and those joints include facet joints, FACET joints, and the SI joint, sacroiliac joint. Shot. Now, the third procedure we developed to eliminate chronic back pain is called the piriformis release, and it's a minimally invasive piriformis release. Now, we were not the first in the world to perform a piriformis release. Other surgeons had done it before us, but they do it open, and it's very painful, dangerous surgery. We do it minimally invasive, not endoscopically, but percutaneously. AP. Is he ready for his discogram?
How are you doing, my friend? You doing okay? You open your eyes
Coker,
for me?
Coker. Anything?
How are you doing? You okay? We're going to ask
Perfect.
you some questions now, all right?
Let's go lateral. So, with the Deuk laser disc repair, the Deuk plasma rhizotomy, and the Deuk piriformis release, those 3 procedures, we're now able to eliminate 99% of back pain with one of those procedures or a combination of them. Shot. In this case, we're doing the Deuk laser disc repair for disc pain. Shot. All right. let's, is he ready?
How are you, my friend? You okay? Open your eyes for me. I'm going to ask you some questions, okay?
So he's, go ahead. He's been watching our surgeries for a while on YouTube, our live streams. And he comes from originally Chile, and now he's here for his back. He did break his ankle 4 weeks ago at work.
You okay?
So he's here with a pink cast. And I told him next time you break your ankle and come to Deuk Spine, wear a blue cast, okay? Have him put a blue cast on. Anyway. All right. So what am I doing here? He's got lower back pain, like everybody else, and it's coming from the disc. He's had it for 12 years. Any questions, Henry?
Yes, we have a question from Samir on YouTube
Go ahead.
asking, Doc, why do people have dizziness or vertigo when they have herniated discs in their neck? Is it because the disc is pushing on their spinal cord?
So the question you're asking about vertigo with herniated disc in the neck, I don't have a good answer for you because I honestly don't know the reason. And I've never heard of a reason. Nobody's ever told me. It's not in the books. It's not in the medical text. No one's ever figured it out. I hear it a lot, though. I hear that people with cervical disc herniations do get vertigo. Is it possible to get it from a herniated disc? Yes. And it's not from pinching a nerve. It's from inflammation. But the exact mechanism, I don't know what it is. And is it related to anxiety and hyperventilation? It could be. So in other words, if you're having pain in your neck from your disc, could it cause anxiety, hyperventilation, circulatory changes? Yes, it could. And that could cause your symptoms. Or is it due to inflammation affecting nerves in the spinal cord? I don't know the answer, but it's probably one of those two. Okay, we're going to do our disc review. Are you comfortable?
How are you doing, my friend? Open your eyes.
Good. All right. So, how bad is that on a scale of 1 to 10? How high does it go, Sean? How high does it go? How high?
What number? What did you say?
I heard him say 10. Is that where you get your pain?
Yes, he said.
All right, good. So L4-5, you can see a giant tear. Show us the tear, Jordan, on the x-ray. Can you see that, Henry?
Yes, we can.
All right, there's a huge tear in the annulus, and the black stuff is the herniation. And the dye is sticking on the herniation. There's a nerve right there. Jordan's showing you the nerve root. So you see how the herniation touches the nerve. All right, that's L4-5. It's called concordant because that is his typical pain he gets every day. Any pain? You saw his back tighten up, by the way, if you go back and watch. Any pain right now?
Give us a number, okay? Amigo, how you doing? Good.
How bad is that on a scale of 1 to 10,
What
Sean?
number?
God, look at the tear. It's huge. All right. How bad did that get? I think he went back to sleep. So we don't know what it is for 5-1. Went back to sleep on us. And I'm not going to torture the poor man. So, but you can see at 5-1 he has the same type of tear. All right, let's get started. We're going to place our dilator and we're going to do our first disc. Shot? What are we doing here, Luis? L4-5? All right, so guide wire's in. Incision has been made. We're removing, stop, shot. All right, so I just pulled the needle and it grabbed on the guide wire and pulled it backwards, but I didn't pull it out of the disc, so that's good. If I did, I'd have to start over again. Remember, if you take your guide wire out accidentally, do not just push it back down. You could end up pushing it in the wrong place. Always redo everything, start over. So it's best if you hold the guide wire and avoid pulling it backwards. Shot. All right, got my dilator. You can see the tip of it there. We're just twisting it and we're gently spreading the muscle fibers apart. Shot. Now the dilator is at the back of the disc at L4-5. You see it? Look at that. Shot. It's literally running underneath the nerve root. You see the nerve root? Show us the nerve root. Okay, what nerve root is that? That's L4 on the right side. and the dilator is going underneath it. So we don't normally get to see the nerve root like that, but the dye that we injected is sticking to that nerve root nicely. And it's highlighting illustrating the nerve root. So you can see how the dilator goes just underneath it, between the nerve root and the disc, herniation. Now we're passing into the disc through the tear. Now we're not going to go into the disc, we're going to go into the annular tear. The annular tear is where her herniation came from. All right, very good. So we've just passed the dilator, which is shaped like a metal pencil, through the foramen and into the tear where the herniation is. Now we're going to bring the tube down over the dilator, and then we're going to remove the dilator, and we're going to fix this man's disc at L4-5. The good news is it's definitely causing his back pain. We verified that with the discogram. The second one at L4-S1, we couldn't get a response because he was asleep, and I think both of them are causing his pain. Any questions?
At this moment, no current questions.
Let's show the audience then how the Deuk laser disc repair works with our new animation video.
Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
Definitely watching it.
It's not like that. No, it's not like that. Great.
I still remember The Witcher.
I watched it with my daughter, you know.
Have you watched The Witcher? I love The Witcher. Have you watched it, Berndes?
All on the same vibe. I watched a little bit of it.
You did? So I was watching Witcher, and there's some really, graphic nudity scenes in The Witcher.
Oh, this is not like that.
Right? And my daughter, this was like the first season of Witcher. My daughter came and she wanted to watch with me, so we were watching together. And this was what? First season of Witcher was like 4 years ago, 5 years ago? So she just turned 18 yesterday. So she was 13 years old. And she sits down and she's watching Witcher. And they have that orgy scene. My wife comes by and she goes, "What the hell? What are you letting your daughter watch?" And I said, "Honey, there's nothing she hasn't already seen, trust me." And it's true. Kids these days, man,
This movie's not like that at all.
with their phones, they could see anything. Yeah, my daughter has a mouth of a truck driver. Which is funny because my wife is the exact opposite. She is the most proper, never cusses, totally proper woman. My daughter is like, honestly, she'd make a drunk truck driver blush. The things she talks about. I mean, she makes me shocked. I'm like, how did you learn those things? Like, I didn't know about them until I was in college. And man, I knew a lot when I was her age.
Yeah, but who taught you those things in college?
You pick them up.
A girl?
No. Whoever. Remember your book on the emergency room, things you find inside people's rectums?
Yeah.
I mean,
Yeah, you still have that in the thing.
yeah. She, anyway, I won't go into details. That said, I would like to check out this Netflix movie, Damsel. I'll check it out. I'm still watching Warrior or Warriors, the one about Chinatown in San Francisco back in the 1800s. Very good show on Netflix.
Well, it's for the, he was a, came over, was attacking the Chinese gangs or something.
Yeah, it's about the Chinese gangs and opium trade and other things. But it's more than that. Huh?
The Gentleman by Guy Ritchie.
Yeah.
It's a really good show. It's about two brothers, totally different people, and they inherit a huge fortune. How they deal with it.
What's the name of it?
The Gentleman.
The Gentleman.
Yeah.
But there's a movie called The Gentleman.
I think it might be something along that line.
The movie with Gentleman is like with Matthew McConaughey. He's like a drug dealer.
Yeah, this is kind of like that.
Gentleman? I think it was called Gentleman.
Yeah, no, it was. Great movie.
Yeah, that was a really good movie. Really good movie. And there's some other characters, like Hugh Grant. He's in there.
Hugh Grant, Jeremy Strong,
Yeah.
Charlie
I think
Hunnam.
This is a take on that.
Huh. All right.
Somebody commented on Armatos on YouTube saying Masters of the Airs on Apple TV is great.
Yeah.
What was that?
Oh,
Masters of the Air.
Masters of the Air. Thank you for commenting. Any
Oh.
questions?
Yes, we have a question from Philip on YouTube
Hello, Philip on YouTube. Welcome to our live stream from Duke Spine Institute.
asking, Dr. Deuk, can your laser treatment fix moderate to severe foraminal narrowing? Thank you.
Yes. Yes, as a matter of fact, the laser surgery you're watching right now is the very best treatment in the world for moderate to severe foraminal narrowing. And when you ask, can it fix it, the answer is yes, but the word fix can be interpreted different ways. So if you have foraminal narrowing and it's causing symptoms, this surgery will fix the symptoms permanently without doing any type of major invasive surgery. We can fix the symptoms of moderate to severe foraminal narrowing. If you look at the MRI afterwards, you're not going to see that big of a difference because it doesn't take much to become symptomatic from foraminal stenosis or narrowing. So this surgery fixes symptoms, but it doesn't make MRIs look normal. So if you're hoping, if he's talking about fix and you mean make it wide open, no. There's really only one surgery that will do that, and that's a Smith-Peterson osteotomy with a fusion. And you don't want that. It's too invasive. It's unnecessary. What people want are they want their symptoms fixed. Nobody goes around and gets an MRI scan done if they have no symptoms of back pain, leg pain, weakness, numbness, tingling, whatever it is. So it's always symptoms that we target with treatment, not just MRI findings. The only time you need to target MRI findings without symptoms is if you have a brain tumor. As a neurosurgeon, I'm talking, or hydrocephalus, and you have these abnormal findings that require treatment even though a patient may not be symptomatic yet. So if you're doing an MRI of somebody's brain and they have a brain tumor and you just happen to find it, you want to treat that even though they don't have symptoms. So when I talk about treatment of symptoms and treatment of stenosis or narrowing, what we're talking about is with degenerative type problems like spinal stenosis, narrowing, you only treat when the patient has symptoms. Having trouble getting to 12 o'clock. So, in other words, we don't treat if they have no symptoms. That's an important concept a lot of people don't understand. A lot of people think treatment is predicated on structural findings on MRI. They're not. Because the problem is all these people that have back pain, leg pain, they're actually suffering from not a structural finding, they're suffering from a physiological problem. And physiological problems, a lot of times you can't even see it on an MRI. That physiological problem is inflammation. Inflammation is the cause of back pain. Inflammation is the cause of leg pain. So when you're talking about treating leg pain or back pain, we're talking about treating a physiological problem, not a structural problem. And that's important because MRIs only find structural problems. Okay? So I get these questions a lot. Can you treat stenosis? Yes, we can. But what we really want is we want you to have no more symptoms of stenosis. And to achieve that, it's not actually the stenosis that's causing your problem. It's the herniated disc that's causing the stenosis that's causing your problem. And the herniated disc, it's not even the structural herniated disc that's causing your problem. It's the physiological herniated disc. That's the inflammation within the herniation. And that's what we're treating right now. This patient has back pain from inflammation in this herniated disc at L4-5 and L5-S1. So our goal is to get rid of the inflammation, which then gets rid of the symptoms. It's not to get rid of the stenosis. The stenosis is still going to be there, even after successful treatment. It just may not be as bad, it may be a little better. But in the end, it's not the stenosis that's causing the symptoms. It's the inflammation that's causing the symptom. So we have misidentified the source of symptoms for many years, for the last 100 years. What stenosis does when it hits a nerve and pinches it, it causes weakness, numbness, and tingling. It doesn't cause pain. Stenosis does not cause pain. Inflammation causes pain. So stenosis is not the same as inflammation. You can have, lots of people have stenosis, they have no inflammation, and they have no symptoms. That's why people with spinal stenosis, it can get really bad before anybody has any symptoms. Because it's not the stenosis causing the symptom, it's the inflammation from the herniation that causes symptoms. It's very important to understand that. This right here is scar tissue from inflammation. I'm zapping it, it's the white stuff. See that? And that's because this patient had a herniated disc. He had an annular tear, herniated disc into the annular tear, and then years of inflammation that's caused all this scar tissue to form. And the herniation is migrated. You see, this thing right here is the vertebral body. That's literally the back of the vertebral body, and it is, the herniation has gone behind the vertebral body. You can see it right here. And that's what I'm zapping away. Trying to get as much of it as I can. Now when I'm done, there'll still be herniation. But the symptoms will be gone. His pain will be gone. So I'm able to eliminate people's back pain without removing the herniation entirely. And by the way, no doctor can completely remove the herniation. It's not possible. The only way to do that is to literally open the patient up and take their spine out and put it on a table and then start cutting the herniation out. But then the patient wouldn't have a spine anymore. And of course, they'd be paralyzed and they'd be dead. So the truth is, no surgeon in the world can remove all the herniation. What we want to do is remove enough herniation so that patients don't have symptoms. Hope that makes sense.
We have another question and or seeking advice.
Sure.
This comes from Amartos, once more on Facebook, YouTube.
You guys see the
excuse me.
tear right here, by the way? That's the tear, annular tear, in the annulus where the herniation came out of. And I'm right at the end of it. There's not much left. Go ahead.
From Amartos on YouTube saying, I have a well-healed ACDF from C5 to C7 from 8 years ago. I had pain, numbness, and weakness in my right arm at that time. For a year now, I have extreme pain right side of my neck. My arm is fine though. Went to three physicians.
I know what it is. I don't need to hear anymore.
No problem.
It's facet joints. You have facet joint pain, and we can fix it for you at Deuk Spine. It'll take us 20 minutes. You'll be asleep. When you wake up, that pain will be gone for the rest of your life. So come to us and we'll fix it. I recommend doing an MRI review, and you're going to need what's called the Deuk plasma rhizotomy. Deuk plasma rhizotomy. It's only available at Deuk Spine Institute. You got to come here. Nobody else knows how to do it, and no one else can fix it for you. What they may end up telling you to do is more fusion, and that would fix it. But why do you want more fusion? And that's going to cause more fusion in the future. So the best treatment is the Deuk plasma rhizotomy. Come and get it done. We're just about done here. I'm just pulling the last pieces of herniation out from the tear. That's the blue things you see my grabber pulling out. And I don't see any more. So I think we're done. This was the L4-5. And you can see some fat. And if we look over here, you'll see the nerve. The nerve is going to be right there. You see the white thing? That's the nerve.
Yes, we do.
And we're just below the nerve, like I told you. Okay. Done with one. One more to go. What other questions can I answer?
No current questions, but we do have a comment from Armato saying they treated the facet with an RFA, but it didn't help.
That's because RFAs don't work. You need to come here and get our treatment. I'm telling you. I wouldn't tell it to you if it wasn't true. Okay? Come and get the Deuk plasma rhizotomy. RFA is a procedure that doesn't work. And if it does work, it never lasts. Our Deuk plasma rhizotomy is unique. We're the only ones that do it. I pioneered it, and it's now patented. It's totally FDA approved. And it's what you need and what you want, whether or not you understand that. I can't do any better than... there's an old saying, you can take a horse to water, but you can't make it drink. If a horse is thirsty, hopefully it'll drink. If it doesn't, it dies. All I can do is teach people, diagnose and teach them. The rest is up to them. Shot? All right, we're moving on to the L4-S1. Keep the questions coming. Shot? All right, if there's no questions now, Henry, maybe just show the video once again of the Deuk laser disc repair. Actually, you know what? Show him the video of the Deuk plasma rhizotomy, lumbar. I know it's his cervical spine, but let him see what we do. I think that would be helpful to this person. And welcome back. We are now treating the next disc. He was having two discs causing his pain, 4551. We're now treating the L4-S1. Any questions from our audience? Hopefully our person who asked us about the facet pain was able to watch that last video and see how we do things differently than an RFA. Now, we developed this technology over a year ago, but it took us a while to get the patent done. And now that the patent's done, we can actually show people what we do. Otherwise, somebody else would try to steal it. But that said, the good thing is we have a solution for you. The bad thing is we're the only ones that do it. And we're going to keep it that way.
We have a question
Sure.
coming from Amartos once more on YouTube, saying, I have pretty good Anthem Insurance, Fortune 500 company. Is there a chance they cover the rhizotomy?
Is there a chance they'll cover it? Yes. There's a chance that Anthem will cover it. I would put that chance at best 25%. There's a 75% chance they won't. You're going to have to fight them. We'll help you fight them, but in the end they may say, nope, we're not covering it. You got to understand something, my friend. Insurance companies are not interested in helping people get medical care. They're interested in taking your money or the money from your employer to pay your premium every month and keeping all of it. And anytime you go and get medical care, you're cutting into their profits. The insurance company's profit is equal to all the money they collect from premiums minus their expenses. And their expenses are administrative costs of hiring claims processors, adjusters, nurse case managers, lawyers, business people, psychiatrists. So they have administrative costs, and then they have medical claim costs. Medical claim cost is basically you going and getting treatment. So if they can keep their administrative costs down by hiring fewer people, and they can keep their medical claim costs down by denying treatment for you. When your doctor says you need something, they say, no, you don't. Your doctor's wrong. They're recommending experimental treatment or something that we don't want to pay for, so we can not pay for it. Now, the most expensive surgeries they pay for are spine surgery. Orthopedic spine surgeries, mostly spine. There are a few surgeries that are more expensive, like heart transplant, kidney transplants. They're a little bit more, maybe. But there's not many treatments that are more expensive than spine surgery. Spine surgery is the most expensive. So of all treatments that cut into their profits, spine surgery cuts in the most. Because number one, it's the most expensive treatment, and number two, there's most people need it. Like, how many people need heart transplant? Almost nobody. How many people need kidney transplant? Almost nobody. How many people need spine surgery? Almost everybody. So insurance companies are not stupid. They recognize that spine surgery isn't just the most expensive surgeries, but it's also the one that most people need. So they've developed a strategy to not pay for it. It's called a denial, and the basis for that is they're going to call it experimental. So they're not really interested in you getting better. They're interested in just not paying. They're happy for you to get the surgery, but they're not happy to pay for it. So they're going to do everything they can to not pay for it. So realistic, 25% maximum chance they'll pay for it. Now, I will tell you this. The better plan you have, the better chance they'll pay. And here's the real catcher. If you get the company you work for is Fortune 500 company, you got to go to the HR, human resource, and you find out who is what's called the plan fiduciary. You ask, who is the plan fiduciary? It's actually on your contract with Blue Cross. I don't know if you know this, but you have a 120-page contract, maybe 130-page. It's called the COC, or Condition of Coverage. And it's a contract between you, the employee, and Blue Cross. I mean, and the employer, not Blue Cross, but the employer. And Blue Cross is the third-party administrator, okay? They're the ones who do the denial. Because if your employer says no, you're going to be pissed at your employer and you're going to leave. So they hire Blue Cross to say no for them. So they're not the bad guy. Your employer is not the bad guy. The administrator is, okay? That's how it works. They're sneaky. Like I said, they have psychiatrists, psychologists, business people, lawyers, all working for them. Best ones from Harvard, Columbia, Yale. And they do all this just to make you, the patients, oblivious to the truth. They don't want you knowing the truth. What I want is for you guys to know the truth. The truth is, your insurance company is more profitable when you don't get the treatment that's recommended for you. So the only way they can deny treatment legally, because they have to answer to the state regulator, is the only way they can say no to you is to call that treatment experimental. If they send you a denial that calls it experimental, and they can prove that it's experimental, then they win. So they're always calling treatments experimental. They'll even tell you the MRI is experimental because they don't want to pay for it. Because they know if they pay for the MRI, it's going to show something that we want to fix. And then they're going to be stuck paying for the bill to fix it, or denying it and getting you angry with them. So they've learned to deny your MRI. If you've ever watched the movie Terminator, then you'll know what I'm talking about. Remember when the machine sent the Terminator back in time to kill the leader of the rebellion, so that he wasn't even born, John Connor, remember? Well, the insurance companies took a lesson from that, and they recognized that if they prevent you from getting an MRI scan, then the surgeon has nothing to recommend surgery for, because you need an MRI. So if they kill the MRI, the cheap MRI, $1,000 MRI, then you can't be recommended for spine surgery. So rather than deny your spine surgery that your doctor recommends, they basically kill the recommendation by killing the MRI. Now your doctor can't recommend spine surgery because they can't see what needs to be fixed. These insurance companies, you don't know the beginning of just how bad they really are. Long story short, though, we're going to take Blue Cross Blue Shield to court soon, our patients are, and sue them, and hopefully win. And if they do, it'll be a huge victory for people. But if they lose, it's going to basically be the death knell for insurance, because insurance companies can basically just say no to anything they want. So you'll pay them $20,000 a year in premium, and they'll give you a Zippo. They'll give you some drug benefits, some emergency room benefits, and that's it. The rest, they're just going to keep denying. So the only way that's going to get fixed is when people like you go out and get what you need and then sue your insurance company for not paying. All right? And that's the only way the insurance companies are going to change and do what they're supposed to do. I know this because I myself had to have sinus surgery a year ago, and United Healthcare denied my surgery, even though I had all the tests done. And I got them done because I paid cash. I paid out of my pocket. Otherwise, they weren't going to let me get the test done. The tests I'm talking about are like a sleep study, where they hook you up to a machine, checks your heart rate, your breathing. They wouldn't even let me do that because they knew if that machine came back showing that I stopped breathing at night, that the surgeon was going to recommend surgery, which he did because the machine showed that I stopped breathing. All right? So I had to pay for that machine test. I had to pay for the CAT scan to show my septum was 90% deviated. I had to pay for all that, and then, even then, they denied my surgery. And I went and paid for it. I paid I think it was $12,000, and I got the surgery done. And I can breathe now. But the insurance company said it was not necessary. It was experimental. Okay? So, you people, you're all fucked unless you start doing something about it. The insurance company is like a bully. They're just going to keep taking your lunch and your lunch money. And you guys are just like, don't even recognize it's a problem. You just think it's normal. It's part of life. Well, in life, when somebody does injustice to you, you have to stand up and fight them. The injustice, the evil. That's what I believe. Now, maybe you don't believe the same way I do, and that's fine. You're entitled to your opinion. But I'm the one doing the broadcast, aren't I? All right, we got 2 minutes left and we're done. I'm the guy with the voice.
I like when they make you have physical therapy, then the insurance doesn't cover the therapy.
Right, yeah, they make you have, Dr. Davis says, it's nice how the insurance makes you have physical therapy, and then they don't cover the physical therapy.
Then you can't afford the out-of-pocket.
And you can't afford the out-of-pocket because now physical therapy, you got to pay like $50 every time you go there. It used to be $10 copay, and they've raised the copay. You folks, you've got to understand something. You have to fight. You don't get it. Whether you fight now or you fight tomorrow, if you guys have to get together and fight the insurance company, they're evil. They're choking you to death. So I advise you fight them now before they get even stronger and more powerful. They're supposed to be there to help you get health care. They're lying to you people. They're telling you guys you're going to get good coverage, and then they don't do the coverage when you need it. But they've taken your money and everybody else's by then. They just don't pay. All right, I think that's it. Let me see. I don't see anything else. All right, we're done. Type your questions up. I'll come answer them for you, but stop being a victim. Fight. I'm going to tell you something. There's one of my favorite movies. Of course, Star Wars is my favorite movie. It is about fighting the evil empire. It is about good versus evil. It's about the little guy taking on the big, powerful enemy that is evil. Okay, that is Star Wars. That is the whole purpose. And that's what you people have to do. You guys are being destroyed by the evil empire. And if you don't fight, you're going to die. They're going to kill you all. They're going to keep taking your money, and they're going to give you nothing in return. Any more questions right now?
We have a lot of questions, yes.
All right, I'll come answer them, but let me show you the incision. So we did this guy's back surgery and fixed his back. Look at the incision here. We lost probably, you see that? It's about 8 millimeters. We're going to put a staple and we're done. We lost probably 2 cc's of blood, which is like 40 drops. So it's pretty much bloodless. He's going to go home in an hour. You know, no hospital, no complications. It's very safe, and most importantly, the success rate of this procedure for a disc herniation, pain, 99.6. Basically round up to 100. All right, I'll be right there. Henry, why don't you show our audience one more time the Deuk plasma rhizotomy for facet pain.
Copy that.
I'm here with a gentleman who came to the Deuk Spine Institute with horrible back pain, pinched nerves, symptoms down your leg, weakness, numbness, and using a walker. He's been struggling now for quite a while. You had the Deuk laser disc repair done yesterday in the morning. We went in with the laser and we cleaned out 2 discs that were really causing pain in your back. They were herniated and starting to degenerate. How do you feel today?
10,000 to 50,000% better. Absolutely wonderful. I can't even, it's hard to explain. Going from not being able to walk 5 feet to being able to almost just walk around the block. It's one day. I mean, it's 24 hours. It's incredible.
And when did you realize you had this relief on your back?
Yesterday, when I got home and got settled down, and there was no pain. There was no pain in the back. There was no pain all the way down the leg to the big toe. It was like, where'd the pain go? It just dissipated. And that's after surgery. So usually you feel like there's surgery, there's going to be some pain. No pain. I can't even explain it.
Well, you're doing a good job. What was life like before you had the Deuk laser disc repair surgery?
I didn't want to live this way. There was no way I would never want to live that way. Never want to. No, excruciating pain. I mean, can't sleep, awake all night. The pain was constant. It never left, but you got so exhausted from feeling the pain that you would finally fall asleep. I would finally fall asleep anywhere from an hour to 2 hours at the max. And 2 hours was a gift. And that's all night long. I had to sleep in the room by myself because I would have kept my wife awake all night. I was just miserable. The most misery I've ever felt.
I met your wife. She's a lovely lady. She's by your side all the time.
Yes, sir.
It's hard when you have so much pain. It takes a toll on you, but also your loved ones.
Yes, it does. And she's been a God's gift. I will say that.
Now, how does she feel about your surgery you had yesterday?
She's very happy for me. She's been through every day of it. And this started before Thanksgiving. And we are 3 days from Christmas. And I'm going to have Christmas without pain. Thank you, God. Thank you, doctor. Thank you, everybody on the staff. This staff is unbelievable. Nicest people I've ever met.
Well, we care about people like you. We want you out of pain and happy and getting on with your life. And tell me about your job. You have an interesting job.
I do. I love my job, and I call it the greatest part-time job in the world. One of the highlights of my job is something I can say about it is it's a job where you can say no to work and you'll have a job the next day. It's the only job in the world that I know you can do this. I'm a stagehand with the International Alliance of Theatrical Stage Employees out of New York, and I love my job. I do everything from entertainment, theaters, arenas, to trade shows.
What's the best show you did?
I've worked with 2 out of 4 Beatles. I've worked with, everybody from Kenny Rogers to Celine Dion. I've worked with Van Halen. I've worked with all big entertainment. And then I've done a lot of medical trade shows, so I know where I'm at. When I come into a medical facility, I look around and go, oh, I know where that comes from, and I know where that comes from. And it's a great job. It's a wonderful, wonderful job. I see things before normal people see things. I saw the first flat screen computer and I didn't think too much of it because I wasn't a computer person. Now it's like, look at the flat screen TVs and it's a great job. That's the trade show side, the side where what keeps our country moving is people buying and selling the products that we use, from the cameras that are on us right now and the lights that are on us right now to doctor's coat that he's wearing and the shirt that I'm wearing. So
and probably some of the equipment we used in your laser spine surgery.
Absolutely. The best shows I do, I have to say, are the medical shows because I go around and I get literature and I read and I learn from past experiences with herniations. I've had double hernia surgery, so I know about that. I've had hand surgery, I've had knee surgery, now I've had back surgery. So I learn and it's, you get to talk to the people that do the work and represent the products, and it's pretty awesome. So I love my job. I miss it. I honestly miss it.
Well, now you're going to be able to go back to work without that pain.
Oh, thank God. Thank you. Thank you, Doc.
You're welcome. Is there anything else you want to say to your fans out there?
If you're having issues, any kind of issues with back, knees, joints, you need to come to Deuk Spine. You just have to. The Institute is wonderful. Everybody here, there is no negativity in this building whatsoever. It's unheard of out there. And I've seen a lot of doctors over the years for different reasons, but there's no negativity here. It's all positive and you leave positive. So I'm very, very happy that I did this. And I tell anybody that has ever gone through any kind of pain, you need to come see Deuk Spine. People come from all over the world, and now I know why. I just came from up the street, so I can tell you, up the street or from another side of the country, just come to Deuk Spine. That's the best I can tell you.
Well, thank you for sharing your story. Congratulations and Happy New Year.
Happy New Year and Merry Christmas to the whole staff. All your people are excellent, to your family as well, and their families. And I hope everybody has a wonderful Christmas. And by the way, the office is magnificent. That is the best I've ever seen. That shows what kind of, when you walk through this office for Christmas holiday, it's all about family. It's all about the holidays. It's about the people that come through.
Thank you.
Thank you
you very much.
Okay, I hope you enjoyed that testimonial. It was wonderful. We've just finished surgery, and I just came out from this patient's surgery, and it went very well. He is from Chile, that's South America, not somewhere cold, but from South America. And he found us on YouTube, like many people do. He watched the surgeries, was intrigued with our new technology and our better technology than what's being available elsewhere. He came here and he had 2 disc injuries. They were both big tears in the annulus. And just so you all understand what I'm talking about, I'm going to grab a little model, okay, so I can show you. You all see that?
Yes, we do. Yep.
All right. I apologize for the weirdness on my fingers, but the disc itself has a wall around it, and it has a jelly center, which is red. You can see when there's a tear in the wall, the jelly can squeeze through the tear and get stuck in the tear and come out. Everybody thinks the part that's out is the problem. It's not. It's the part stuck in the wall. That's what we discovered. I discovered at Deuk Spine Institute. I call that the interposed herniation, I-N-T-E-R-P-O-S-E-D, because it's interposed between the annular tear. The word was taught to me by Dr. Anthony Young, who actually taught me a lot about endoscopic surgery on the lumbar spine, not cervical or thoracic, lumbar. That said, it's called the interposed herniation. That's the problem. That interposed herniation is what I debrided with the laser. That's what we're in there cleaning out. That's what causes the back pain and the leg pain. And if it's in the neck, it's neck pain, arm pain, headaches. So the interposed herniation causes inflammation. The inflammation is what your body perceives as pain, headaches, arm pain, neck pain, or back and leg pain. Pressure on the nerve root never causes pain. It always causes weakness, numbness, or tingling. 3 things: weakness, numbness, tingling. It can cause something called neurogenic claudication, which is really weakness. It's kind of a combination of weakness and numbness. That said, pressure on a nerve is what most neurosurgeons are operating on. Inflammation on the nerve and inflammation in the disc, that's what we operate at Deuk Spine Institute. That's what makes us different. It's because we recognize 99% of people with back and neck pain, it's coming from inflammation in their disc or facet joints. This case went perfect, and we have a lot of questions. So without further ado, we'll get to the questions.
First one from.
By the way, I do want to say one more thing. If we fix your back, please do not make us brownies, all right? Because I have a weak spot for brownies, and this is my second one, and I shouldn't be eating brownies, okay? It's not good for me. So if you're going to do something for us, you know, buy us pizza. Right, Davis? Pizza's a lot better than brownies. All right.
Take out tacos.
Or you can buy us fruit. It's healthy. Okay. No, I'm kidding though, but we appreciate the gifts from our patients. Go ahead, Henry.
Tracy on Facebook asked, saying, I may be coming soon for some lumbar DPRs. I may want to have a DPR on my knee. If so, I'm hoping I could do it at the same time as my lumbar DPRs.
Come meet the doctor who will do your knee DPR. Come on over here. This is Dr. Davis.
That would be me.
Dr. Davis is an orthopedic surgeon, and he's the one who does the knee DPRs along with Dr. Patel.
That's right.
So anyway, here he is. That's who you're going to talk to.
And they're asking, what might be the best imaging for me to get for my knee, an X-ray or an MRI?
Probably both, right? X-ray and MRI if you have it.
Yeah, depending on, I would discount both.
We would like to have both. X-ray and MRI.
Okay. And then next question from Armatos on Facebook. No, excuse me. Why do I keep saying Facebook? YouTube. Armatos on YouTube, asking, in case I have to pay it out of pocket, is there a ballpark price for it?
Is there a ballpark price for the DLDR?
I think for the rhizotomy, the DPR.
I don't have a ballpark price. We can give you the actual price after you've done your MRI review.
Yeah.
Whoops.
Put that in the way. No way.
A little comedy.
I just looked up and I was like, wait, what?
I was eating strawberries. Next thing you knew, I had a disc in my mouth. All right.
The next question from Izod on YouTube.
Izod, welcome.
Asking, hi doc, what is disc replacement? Is it recommended? As you said, complete herniation can't be removed. Whether disc replacement substitutes the laser treatment that you carry out?
All right. So, first of all, what is a disc replacement? Okay? This is a disc replacement. So, the problem, folks, is that the disc here, damage to the disc, which is the cushion between your bones, is the #1 cause of back pain, leg pain in the lower back, period. It's 85% of patients with back pain, it's coming from a disc problem. It could be 1 disc, 2 disc, 3 disc. On average, it's 2.2 discs. That's what we found, 2.2. So if your surgeon wants to fix one, chances are you're still going to have problems from the other one that you probably have. Now, some people have only 1 disc. That's the cause of their pain. That's less than 10% of the patients with disc problems, okay? Now, a popular treatment is to take the whole disc out and put this metal thing in there instead. You guys see that?
Yes, we do.
It's called an artificial disc. Now, it moves, but it's horrible because they pop out. And if you go back 2 weeks, we had a patient here who had an artificial disc and it popped out of their spine. So I had to go in and do a fusion for her. It's called a rescue fusion. You don't want metal in your body, folks. You don't want metal in your spine, period. You don't need it. The surgery that you want is not a disc replacement or a fusion. It is the surgery you just watched, the Deuk laser disc repair. The surgery I just did, endoscopic laser surgery, can be used to fix any disc problem there is. You don't need fusion anymore. You don't need artificial disc, ever. The only reason you need fusion is if you have a fractured dislocation, which happens with a high-speed auto accident, like you're in a car, you're traveling 80 miles an hour, you hit something like a tree, and then your spine rips apart. I can't do laser surgery for that. You need a fusion done. So that's, but how many people does that happen to? Almost nobody. 98% of spine surgery is done for disc injuries, which I can fix with the laser. So you don't need this fusion with screws and a cage. See the cage? And you don't need artificial joints made out of metal. The only reason these are popular, folks, is because the companies that make these metal, they are promoting them to the surgeons while they're in their training. They're getting the surgeons doing this. It's no different than the tobacco industry putting cigarettes in kids' lunch pails to get them hooked on nicotine and smoking. It's bad for you, it's horrible for you, but nobody's stopping them. Okay, it is a scam. It is a spine scam. Remember those 2 words, spine scam. And surgeons are growing up with this metal and they believe it's the treatment for everybody, so they're recommending it to you. You don't need it. It is a lie. It is deceitful. It is a chicanery, and people are getting all these surgeries done with metal when they don't need it, okay? If you have an infection of your spine is being eaten by the infection and falling apart, get a fusion. If you have a fractured dislocation from a high-speed motor vehicle accident, get a fusion. But 98% of people don't have that as their cause of pain. They have a disc problem or a facet problem. You don't need any of that metal in your body, so stay away from it. That's my advice.
And then lastly, I thought this was a question, but it's I think seeking for advice or comments, saying from Amartos on YouTube, saying, I am pretty happy with my insurance so far. They covered MRI, RFA, 2 steroid injections, bone scan, and physical therapy without any issues.
Wonderful. So
maybe I get lucky.
You got nothing to worry about, Amartos. Come and get your laser surgery done.
Yeah.
And then we'll give you a reason to hate your insurance company.
And then from Izod, just commenting, thank you for explaining, and other than that, no further questions.
Well, I'm sorry I'm eating my fruit in front of you, but I can't help myself. My son challenged me to eat fruit in front of you, so I'm doing it. That said, I hope you enjoyed the surgery. It went very well for the patient, all jokes aside. We got everything done with a little cut on his back that big. He's going to be back on his feet in an hour. He'll be out of here in an hour. And it's going to be a life-changing surgery for him. I think we've got the source of pain, those 2 discs. We verified that in the operation with a discogram at 0.45, and he had 10 out of 10 pain at that point. So, yeah, I think he's going to do great. And I'm glad you're here. You guys had an opportunity to learn something, and we'll be back in, well, however long it takes Dr. Burndas to have his lunch. We'll be back probably in about 25 minutes with our last live stream Deuk laser disc repair. This patient comes to us from Boston, Massachusetts, and he has been searching and searching on the internet looking for the best treatment for his back. He has a herniated disc at 0.45 on both sides, so the nerves are getting pinched on both sides. We're going to go in bilateral L4-5 and fix both sides at 0.45. He also has a herniation, I think, at 3.4.
I think so, yeah.
But he's not getting that one fixed because he just wants me to focus on one disc. That said, you'll be able to ask questions, and that will be our last case for this week. Thanks for joining.